So the coronavirus is taking an increasingly dramatic toll, both health-wise and in the economy, and in the psyches of the American public and people around the world. We've seen more than 3 million people file for unemployment benefits in the last week. We've seen thousands of cases mounting at an incredible speed here in the United States, where there are more than 50,000 cases as of Thursday morning. Across the globe, more than 500,000 people are infected with the coronavirus, and the real number is probably multiples larger than that. The thing that people are worried about most is the knock-on effects, essentially. So more people may die because of the coronavirus than from it. And what I mean by that is when a health system becomes overwhelmed, people who are seeking normal care for other diseases tend to become they miss out on the care that they might otherwise have. We saw this in the Ebola outbreak 5 years ago, when more people died of things like cholera and malaria in West Africa than died of the Ebola virus. Now, cholera and malaria are treatable diseases, but the fact is the health systems were just so overwhelmed that those people who would ordinarily go get treatment weren't able to. What we're likely to see in the United States, it's not cholera and malaria, but it could be hypertension and high blood pressure and heart disease that a lot of people suffer from, that they might not be able to get the care that they necessarily need. Another thing that's concerning is the epidemic of loneliness that we've seen across the United States over the last decade or so. There's been a rise in what epidemiologists call deaths of despair, suicide, alcohol abuse, drug abuse, overdoses, things like that. And when we're practicing the social distancing, that becomes a big factor as well. It becomes a risk that follows along with the coronavirus itself.
When I look at these poll numbers and I see that more than 7 in 10 Americans believe that coronavirus will impact their personal life, I think it really highlights just the exponential increase in concern that the American public is feeling and has started to feel in recent days, let alone recent weeks. If you look at these polling numbers over time, it has nearly doubled since February, where just a third of Americans said that they felt like coronavirus would impact their personal life. So you see this kind of exponential growth in such a short amount of time, and it tells me that Americans are really starting to feel the effects of the coronavirus outbreak, starting to feel the effects of shelter-in-place requirements, work from home mandates from their employers, and our way of life as we know it is changing for the foreseeable future. Now, we also just released polling our latest Axios Ipsos Coronavirus Index. So this is the second installment of this poll, and we've been looking at things weekly. In just 1 week, what I can tell you is that things have changed dramatically, especially when it comes to people's work environment, and especially when it comes to their mental health and their emotional well-being. More people feel like their mental health is worsening. That number has grown nearly 15 percentage points in just 1 week. More people feel that their emotional well-being is worse. 43% say that this week compared to 29% last week. And actually the number that report that they're quarantining has quadrupled in just 1 week.
I sincerely hope that this coronavirus is going to change all of us in the long run. Humans are not necessarily great at planning for the future. Let's use this as a huge warning and an opportunity to plan for the next pandemic, because it's coming. There will be another flu pandemic. There will be another outbreak, whether it's coronavirus or some other family of viruses. Let's do what we can now to bolster our health systems, make them as strong as possible, and frankly, invest the money in government, which is the only thing that is able to bend the curve downward. This is a great opportunity. If there's a silver lining on this very dark cloud, there's an opportunity to plan for the future and make American society and global society better, safer, and save more lives. We need to pay attention now. We need to spread expertise, not hoard expertise, and make everybody smarter and more aware of what we can do in the future to make the next one a much less severe outbreak than this one is going to be.